Hey everyone, I'm Shannon with Therapy by Shannon and Be Mindful Louisville. Welcome to our Ask Anything series. These are questions that have been submitted by you guys and we're getting them answered by mental health and wellness professionals. And today we are here with Tamika S. Leavell. She is a licensed clinical social worker. She's in private practice with Leavell Counseling LLC in Louisville, Kentucky. She holds a license in the state of Kentucky at the present time and is temporarily holding a license in the state of Indiana with a goal of permanent licensure coming soon. So that's super exciting. She's really committed to providing quality services to individuals desiring growth and change. And she really looks forward to supporting clients in their process of growth and change in their individual lives. She currently provides therapy sessions via a secure online platform. So clients all throughout the state of Kentucky can use her services, and you can follow her on Facebook and Instagram at Leavell Counseling LLC, and she has a website that you can learn all sorts of things about her, and that's leavellcounselingllc.com. But okay, Tamika, let's jump into the question today. The question that was submitted is, I have a therapist, but I don't think he's right for me. I don't want to hurt his feelings, so what should I do?
Such a good question. And I think it's really important that before you go into having any type of conversation that you consider your why for starting counseling in the first place. Because a lot of times we come into the room because we are trying to navigate having assertive communication or finding coping skills or coping strategies to, manage our own feelings of self-doubt or anxiety or depression, our perceived perception of how other people see us. So it can be very unnerving to have a dialogue with your clinician about, I don't think you're a good fit. What I encourage clients to do from my seat, and then what I would then encourage clients to do outside of spaces with me, is to ask to have open and effective communication at the onset of counseling. So of course, if you're not at the onset, this is something that maybe you can look at a little later, but at the onset of counseling, are you open to having conversation about feedback that you provide to me in the case that I don't know if it's a good fit for me? What's the process of therapy? What's your expectation of me as a client coming to you? Having those types of conversations up front can allow space for you to feel like you can voice something on the contrary that your therapist or clinician may say. So that's helpful at the onset. If you're already in the trenches doing the work and you find that, I thought that person was a good match for me and now I'm thinking otherwise, it's very important for you to advocate for yourself, because this is your space for your growth. And every therapist and every clinician, their bottom line intention is that you get the best of what they have to offer you in your growth. And if by chance you're not finding that they're the person to get you to the finish line, then it's okay to say that, because their goal is to get you to the next level. And sometimes the therapist that you're sitting in a room with is not the one that you're going to go to the finish line with. And we all know that. Every clinician knows that, you may be working with a client temporarily and they may go work with someone else, or that client may absolutely meet their treatment goal with you. So the client has that awareness, but if you don't convey to them that you are struggling in the relationship a bit, or not able to connect with them in a way that allows you to take what's offered and apply it in any capacity, then we have to ask you to say that to us. And it is going to be uncomfortable. There's no way that it's not, to say to someone like, thanks, but I think I need something else, or someone else. But you have to, because this is for you. You went into counseling with a why. You had a goal, you had a hope, you had a gain. And if that therapist or counselor is not helping you to get it, then it's important you have the conversations. You have treatment plans and you have goals and objectives. And if you're not moving toward those and you're moving away, then that person needs to know to be able to better support you and to provide you with resources to seek out who you're looking for. And even in the process of termination with that person, they may be able to support you in having a more streamlined thought of how you go into the next space, because it can be, anxiety providing to go into the next space with a new person because you don't want to repeat the same pattern.
Yeah.
So that person may be able to support you in your growth to the next space if you are communicating with them that you don't think that they're a good fit. And that's absolutely okay. And you may be asked why, which can be uncomfortable, but your truth is your truth and your feelings are valid. And so being truthful about your why you don't think you're a good fit and the reason why is absolutely necessary for your growth to reach the goal that you have at the onset of your counseling anyway. So
Yeah.
uncomfortable, absolutely, but necessary, most certainly.
Yeah. Yeah. And it doesn't mean anything about you or that therapist. There's
Yeah.
lots of therapists in Kentucky and lots of
Yeah,
clients in Kentucky.
absolutely.
And sometimes that
Absolutely.
therapist can, of course, help you find a better fitting therapist if they know a little bit
Mhm,
about you
mhm.
and what you're looking for.
Yeah, yeah, absolutely. And I tell clients all the time, from a personal perspective, my having to learn that I wasn't going to be the person to get people to the finish line, and having, you know, a client early in my career that I worked with for years, and she was a kiddo. And she struggled while I worked with her. And then she started to work with another clinician. At that point, she had already been 3 years in. And she was able to attain all the goals that she and I had set for her. And it was very hurtful for me, but
Sure.
I was able to, you know, process that in a way with a colleague. So that's why therapists have counselors and colleagues and consultation groups to be able to process those things, not your responsibility as a client. To really be able to see, like, my goal was to get her to the second and the third leg of the race. That was my goal. And she accomplished that. So great job for her accomplishing that. And my role in her life is finished. And so the next person comes in and gets the client to the finish line. And it's a win for everyone. It's a win for the client for reaching the goal. And it's a win for her support people, past and present and future, because she is attaining and she is growing, even if the growth feels slow or even invisible. Growth is happening on a regular basis. Every time you show up into your counseling session and don't cancel, that's growth. So just knowing that that person, that clinician that you're thinking isn't the right fit, was a fit for the moment. And then you move and you grow into the next space. So
Yeah.
every clinician, you know, hopefully has that mindset. And if they're having a tough time, they have consultation groups and other clinicians that they then process that with. But again, as a client, your sole responsibility is your own personal growth. And if you don't feel that it is necessary or effective for you anymore being in the space with a clinician, you've got to grow. And sometimes you have to go to grow. And that's part of the process.
Yeah. Yeah. You've already given us so much good information, but is there anything, kind of any tidbits or last little things you want to share with our audience?
Um, That's a really good question, and it makes me go all in my brain. I guess I would just be repetitive and saying to people that when you come into a space to start to do any work, clinicians are going to ask you what you're wanting to work toward and work on. And sometimes, again, growth can be a little slow. It can be a little painful. It can be tremendously uncomfortable. But if you're uncomfortable and you're starting to feel some growing pains, it's because you're growing. So absolutely stay the course. Be assertive in your communication and saying, like, I feel this way this week. It's so very necessary. Your why is important. We may, as therapists on the other side of the room, have an idea about growing from your space of where you wanted to grow and how you can navigate that growth. But if that doesn't work for you, it doesn't work for you. And it's absolutely okay. We're here to support you in your growth, and to challenge you to grow beyond the discomfort. But if what we're pushing and challenging and encouraging you to consider and shift to and tap into is too much in the moment, we have to know that from you because we won't know otherwise. So this is your journey. You are the captain. We are on this ship riding the waves with you from a different lens. Like, it looks like there's something, 12 feet ahead, like, be prepared for it.
Yeah.
In a sense, and not taking over the wheel. This is your journey and we're here to support you in it. So always know that the goal is for you to hit the mark the way that you desire to get the gain. And we assist you in this process.
Yeah.
You have the control.
Yeah, of course. Oh, thank you so much, Tamika. For those of you that want to get connected with her, remember you can follow her on Instagram, Facebook, go to her website. It's all under her last name, Leavell Counseling LLC. And then if you guys have any questions that you want answered by mental health professionals, just DM us. We'll get those answered for you. And yeah, have a good day until I see you next time.
Yeah.